Hello, and welcome to the If We Knew Then podcast. I'm Stephen Socks.
And I'm Lori Socks.
And today we're joined by Dr. Jill Lasky from the Lasky Pediatric Dental Group in Southern California, Studio City. We've known Dr. Jill and her husband Michael since Sophia was a toddler.
About 10 years.
Yeah, 10 years probably.
I don't even remember the recommendation that led us to Dr. Jill, but what a find. I feel like we say this about a lot of people in our life. We've been really fortunate to have been led in the right direction. And when it comes to dentistry and going to the dentist as a parent, so overwhelmed by that thought because I know what my experience with the dentist is. And the thought of my child getting a cavity and having to go through that process was really intimidating.
And not even what your experience is now with dentists, but I think of what my experience was as a child.
No, that's what I'm talking about.
Oh, yeah. I mean, as a child, there wasn't a pediatric dentist. It was like my parents' dentist who was just a guy who didn't really know how to deal with kids and just suck it up. I've got these big hands. I'm going to put them in your mouth and we're going to dig around there and just deal with it.
And so meeting Dr. Jill was just a gift because it came out of necessity when Sophia
had some dental issues.
She had some dental issues and had to actually go through some surgery.
Yeah. No, Dr. Jill has been great. And her whole staff. I mean, she's got a front desk people that are great, the hygienists. There's a gentleman that does the x-rays. They're always so attentive to the kids and how they're feeling at that moment and adjusting. And I think we'll talk about that a lot in this episode, is just how each child, just like each person, no matter what, they're all unique and you have to work in a unique, fluid environment.
They made going to the dentist a non-issue. And as a parent, let's face it, it's great not to have something be an issue. She has an expertise in pediatrics, and so she's agreed to come talk to us.
I'm excited.
Whoever thought I'd be excited to see the dentist?
Let's start.
Yep, here we go.
Well, thank you for joining us, Dr. Jill.
Hello. I'm so happy to be here today.
Well, we're happy to have you. Maybe you could give us a little insight and tell us a little bit about yourself and your practice.
Of course. My name is Jill Lasky, and I am a pediatric dentist here in Studio City, California. Not everybody knows what a pediatric dentist is. So after dental school, you can specialize in braces or gum disease or root canals, and there is a subspecialty called pediatric dentistry. So I have extra training in the growth and development of strictly children from age 0 to 18. And in that kind of training, you also spend a lot of time learning about children with special needs and how to treat them and their unique challenges and advantages that comes with children that have neurological differences. So that's what my practice specializes in as well, is just kind of routine cleaning and fillings for kids of all ages.
Yeah, how does that look? How were you instructed about kids in all different spectrums of disabilities?
I personally did a 2-year residency at Children's Hospital Boston. And in that time, we treated the greater Boston area. And also there was a lot of clinics, like craniofacial clinics, that had to do with children with all types of syndromes. And then there was also a special autism program at the hospital at the time. And then we had to treat all the children that are on the floor that were going through different surgical procedures, had leukemia or any other pediatric cancers. So it was just an intense 2-year training when I was just basically lived at the hospital as a resident.
I didn't know you were at Children's in Boston. That's a fantastic hospital.
Yes, it was association with Harvard Medical School. So we also had some training at the dental school there as well. It was a wonderful time, so an intense experience, but it definitely prepared me and gave me the foundation for myself to grow and learn and develop my own style in my private practice here in California.
Well, specifically to Down syndrome, did you have any personal experience with children?
I mean, I had quite a few when I was a resident, and then in my private practice now, I have the honor of, caring for Liam and a handful of other children with Down syndrome. A lot of what I do when I'm with the kids with Down syndrome are similar to other kids with, that are like neurologically different. But at the same time, a lot of it's the same what you do with everybody. I think the core of my philosophy with treating any child is to kind of make that connection, make that touch point with them at whatever level they're at, and to try to feel and build a trust with them, because that's the core of all treatment. If you can gain trust and establish a connection, you can go so much farther with anything you have to do, especially, the dreaded dental treatment that so many people are fearful of. So we try to make it as a positive experience as possible.
Well, that's one thing we've learned with Liam is just that we didn't know he was born was just how normal things were going to be. Just how we were going to just treat him the same, and you just kind of gauge each kid differently because everyone's unique, and that's probably in your practice as well. Like you said, I mean, you could have just dozens of typical kids that are just all different. They're just all over the place, and you have to be precise and individualize with your care.
100%. I mean, that's, a kid that might be a superstar socially, just can't stand going to the dentist. I mean, the oral cavity is such a private area that you at the same time experience so much of life with. I mean, think about toddlers. They're always have their hands in their mouth and they're exploring the world with their mouth. So I have to basically invite myself into that private area and make sure that they're comfortable before, and make sure they're comfortable with me as a person via like touch, and where are they on their um, understanding, and where are they on their communication. All of that goes into the first few minutes that I'm meeting the child. I kind of have a ability to assess all of those things and then take it from there. In addition, it's so important to make sure that the parents are comfortable with what you're doing, because so much of a child, especially 0 to 3, but even older, they gauge on the comfort level with the parent. So it's key in my practice to make sure that I understand what the parents' concerns are, because my concerns might not be what their concerns are, to make sure the parents have a voice. And if they feel comfortable, their energy is then projected onto their child, and it helps the comfort level and helps settle the child down before I have to do whatever I have to do.
Yeah, it is a very intimate relationship that you get in with your dentist. And when do you advise that parents start to talk about the dentist and dentistry to their children?
So I think that's important. It's critical to find a dental home, is what we like to call it, um, by the child's first birthday, because and for all children. And I think that by age 1, if they have teeth or if they don't have teeth, there is some movement. They're scooting around, they might, they're pulling up, they're walking. The risk of having any kind of dental trauma increases, than before, when they weren't mobile. So no, it's very stressful if your child falls down and has any kind of trauma to their mouth, to then scram and be like, where do I go? And honestly, adore pediatricians, but they don't get much education in medical school how to care for the mouth. So that is not the first place to go to. So if you already have established a dental home, or having a dentist something to go to, that's key. Then the next thing is, typically children, on that, not all, and that's especially ones with Down syndrome, tend to get teeth later, but not even all children sometimes don't have a tooth by the first birthday. But if they have a tooth, you really should care for it. So by that first birthday, parents should have a checkup for their child, but it's really mostly for the parent and less about the child, just so the parents can learn how to best care for their children's teeth. And most kids are more on solid foods by then, and what food choices are best, and also really to kind of have an idea, especially kids with Down syndrome, get a basic idea of what do our parents have to possibly expect over the next 6 months, because for that 12 to 18 months, a lot of things do change. And the parents, if you understand and have the knowledge, it's a lot more anxiety it reduces the anxiety levels if you have information and if you have a place to go in case something happens. So by the first birthday for sure.
I remember I was thinking back at Liam's first birthday, and I know his teeth came in a little later than Sophia's did, but I remember him having sticking his tongue out sometimes, not only just when he was concentrating, but even just when he would relax a little bit. I think it was a low tone. I think it's something that's common in children with Down syndrome, and I remember just getting in this rhythm of just always just putting my finger gently and just pushing his tongue back in his mouth and just saying tongue in and just kind of encouraging that. I had actually seen on the internet yesterday someone asking that question of what do I do for protruding tongue, and I almost responded on Facebook with what I did. Maybe you could tell us as a professional, is there a recommendation for protruding tongues?
So kids with Down syndrome definitely have larger tongues. That's a very common dental manifestation of the syndrome, along with smaller teeth, narrow jaws, and a larger lower jaw, kind of like the bulldog, like the underbite look, and a smaller upper jaw. So the kind of combination of everything makes the tongue kind of stick out. And some of the times it's because of muscle tone, like you'd mentioned with Liam, and trying to kind of, work with, if you hopefully have some other occupational therapy that they can kind of help, or language or anything, one of the other therapies as well, to kind of help remind him to get the tongue in if they can. But sometimes some of the children, their tongues don't really fit in the mouth yet. So besides the reminder with what you did with your finger, the next thing is to making sure that it's kind of moist all the time, making sure the salivary flow is there, and making sure that it's clean. Because those are the things that if they're not clean and if they're not moist, you can get into problems. But the reminder of it helps. When they're older, there are some orthodontic appliances that they can kind of help, or orthodontists, depending on the cooperation level of a child, that might need to intervene to help it physically fit in the mouth better, help, widen the jaw and do some things. So it's kind of, there's many different factors, but having the tongue kind of stick out is a typical, not even habit, it's just placement of the tongue with kids with Down syndrome.
So let's say the mouth is dry. What do you do about that?
So making sure the fluids are always there, and also to make sure that all the salivary glands are working properly. So that would be something that they're having to visit the dentist. And also, if it happens to be dry, there are different like toothpaste and salves that you can put on. But again, that's something that the body usually does compensate and keeps it moist. But keeping it clean is probably the biggest thing that a parent can do at home. And I would do that by just taking a washcloth and wiping the tongue, and wiping it from as far back as a child can tolerate without gagging, and going outwards, because that will make sure that all the bacteria and things don't stay on the tongue. You're actually wiping it out. When you brush with a toothbrush, it kind of swirls it around. So that's not as beneficial as taking a washcloth or a gauze and just kind of wiping it out. That's a better way of keeping the tongue clean.
Like kind of tongue scraping, I guess.
Exactly. I mean, you can use a scraper, but it's a lot of times a lot easier to just use a washcloth or some little gauze that you can get at the drugstore.
And speaking of brushing the teeth and that might kind of swirl things around, Liam is great with brushing his teeth. I mean, he does as good a job as he can. We follow up with him, but he's very independent in doing it. And for listeners out there, we've had so many more problems with Sophia's teeth than Liam's.
And I can speak to that. Some of that does have to do with the spacing of the teeth. The teeth are smaller. There's typically more space between them. And if the tongue is larger, it's actually more protective, because your tongue typically is moist, and and saliva has a lot of protective qualities in it. So usually kids with Down syndrome have less decay, but maybe have more gum disease issues, depending how much lip competence or how easily it is for them to close their mouth, to keep their gums, the lips over the gums. So it is usually, and then they create a lot more tartar typically, just the way the saliva is. So you usually have less cavities. Like that's what parents usually think of. I have good teeth or bad teeth, depending on how much decay there is. So it is a true and common statement for kids with Down syndrome to have less decay. And that's why I know that you made the comment about having more issues with Sophia, either from the decay point of view or also crowding and things like that, because Liam's mouth is more forgiving in that sense, which is definitely a silver lining and a blessing.
It should be a relief to parents because I'll tell you, when we brought Liam to you after having Sophia with you for a couple of years and seeing what just having cavities and just some things, I was rolling my eyes going, now what are we going to have with Liam? But it's been great.
Yeah, it's really, yeah. The biggest thing is really the shape of the face and the discrepancy between the discrepancy between the size of the upper and lower jaw, which is something you typically deal with when they're done growing. And depending on the severity, you may or may not need orthodontic or jaw surgery to align to make sure that chewing is, as easy as possible. But that varies, just like, the different severity and the different shape of the face. You kind of have to assess that on an individual basis. But there are plenty of clinics and doctors throughout the country that are well versed in making sure that your child can masticate or chew, the best possible. But a lot of that is just done when they're completely done growing. That's when those things are taken care of. But finding a dentist that can help you until you get to that point is key, and making sure that you have routine visits, having that be once a month to make sure your child is comfortable and can tolerate things in a dental, setting, to all the way to, every 6 months if they're kind of used to it and roll with it and their dental needs are not extreme. And anywhere on that spectrum, it is important to stay on top of their dental care, because like anything else, the more you kind of avoid it because you might have angst and your own issues about dentistry itself, the worse it's going to be. So, it's like you just kind of have to say, we just got to push through this, because at the end, it will be definitely more beneficial for your child if they have routine care. I know sometimes it seems overwhelming to have one more thing you have to do, but it is really important to make things as easy to catch things when they're small and, easier to handle than when they get larger and bigger problems.
So, what can we do at home to prepare a child for dental care and visiting the dentist?
I think that introducing the toothbrush and even a washcloth, getting inside the child's mouth at 6 months, between 6 and 8 months, I think is critical, even if there's absolutely no tooth. I think that I tell parents when they're, have the child on the changing table, and just before they go to bed, to take a washcloth or a little finger brush, and there could be absolutely nothing on it. Or it could be, we have some water, or it could have a natural fluoride-free toothpaste. Um, any of those, whatever you think your child would, be most cooperative, or you can try them all and see what works. And one thing might work 1 week and 2 weeks later it doesn't, and you go to the next thing. But I think just making them aware and just talking and saying, now mom or dad or, grandma or whoever's putting them to bed, is be like, we're going to wipe our teeth now. And just talking to the child and making them aware that even though there's nothing in there right now, that this is something that we have to clean, just like we have to clean your bottom and, the rest of your body. So that is something that I really think is critical for all children. And then around that, like kind of 6 to 8 months, or later, just whenever they kind of seem like this is something we can put on our plate now, when you kind of get out of that a little bit of the fog, I think it's critical to do that. Then you can also incorporate into your, reading any kind of books about going to the dentist, just so they just kind of aware that there's something that you go to take care of. Then just modeling, I think, is really important for your kids, to have them, in the bathroom when you're brushing your teeth, and just talking about it with them. All of that, the earlier the better, I think, to do. So when they do go to the dentist for the first visit, they might not register, remember it, but they'll have that in their subconscious to know that this is something we have to be doing. And the first visit is what I recommend, because it's really for the parent to have a dental home. So they know, and that's really parent education appointment more than the child. And we will look in their mouth. So even if there isn't a tooth at a year, I think between year, 14 months or so, definitely the latest by 18 months, you should go their first visit, but you should at least maybe establish some place to go around a year. And bringing to the dentist any songs or things that you do at home with your child helps. If you let the dentist know that then he or she can incorporate that into the visit as well, make it a easier transition for that child for that first visit.
A lot of people, their kids have siblings as well. So are there methods that one, the sibling may have as much anxiety about going to the dentist, or I know that in our case, Sophia had definitely more angst about the dentist than Liam ever did. I think he just kind of rolled with the punches. Anything that you could speak on with the siblings, how to incorporate them?
Sometimes it works both ways. I have parents, I always ask them, especially for the second one, do you think that your older sibling would be helpful to model? Every dynamic is different, right? And if the older one is more fearful, sometimes I have the little ones go first and model for their older siblings, what it's like to go into sit in the dental chair. It's so variable. I think the best thing to do is to communicate with your medical provider and just to figure out the best plan to see if the children should be together, be separate, bring them on different days, which one should go first. I think that if the younger child likes to emulate the older one and the older one is fearful, it might be better to remove the older child from the situation. If it's the opposite, it's helpful to have them come.
I think that's my concern is for, parents who maybe their atypical child has a lot of angst and fear. I know one thing we always talk to Sophia about is, Liam looks up to you and he's going to mimic you. So how do we take their fears out of the whole equation because, Sophia ultimately mostly grew out of those fears. But our fear was that Liam would see, I should be afraid of this. And then it would be a much harder behavior. I know he'd grow out of it, but it would be so much work to get him to grow out of that initial fear.
Yes, I hear what you're thinking. That makes logical sense. I'm going to tell you from my 20 plus years of experience treating kids, so much of it is innate. Some people are just are fearful for absolutely no reason. Nothing ever happened to them. In this, to them that of knowledge. I think there is just when someone asked me this before, and I mentioned my son Jack was scared of dogs. Nothing happened to him. He came out petrified of dogs, and people ask, why, and I'm like, well, I don't know. Why are you drawn to them? I think that there's something in our DNA, or we can get spiritual and hypothetical about this, but I think you kind of come in a lot of times with these fears or not. So the good news is that although so many people have anxiety about it, it's important for me to really judge where the parent is, because a lot of times a lot of the energy comes from the parents. If the parents have angst, I need to make sure that they feel comfortable before I even step near the child's mouth. I think it's important as a provider to really make sure you connect on a personal level first before you go and invite yourself into that very private space of their mouth. So then I'll know, I have to work some ways with kids that are more anxious, Sophia, or my son Jack. Or sometimes I have to, it's fine. We can honestly, I kind of get that. I feel that the kids will jump in the chair, and even though they might hate the pediatrician, they're fine with me. Or sometimes they're fine with the pediatrician and then, don't want anyone in their personal, space in their mouth. So I think a lot of it is finding the right match with the dentist who can kind of look beyond what their preconceived, or make sure they don't have any preconceived ideas about how any child's going to react with Down syndrome or not, and really be kind of aware of what I have to deal with right now in the room at this moment, and then be able to adjust accordingly on how they're going to provide their care. think that's really important. And hopefully there's a lot of pediatric dentists or family dentists, depending on, where you are in the country. There's not always a pediatric specialist, available. It's important for a parent to find that right fit. So then their child, no matter if they are typical or not, to thrive and get the most out of their dental experience. Because that's the reason why I became a pediatric dentist, is that I'm really molding how their kids are going to care for their bodies, or at least I hope that I'm influencing. I don't know if I'm molding, I'm influencing how they're going to perceive, dental care. And it's such a critical importance to your overall health, especially long term. And think about as you get older, heart disease and diabetes and so many other things are connected to really how healthy your mouth is. So if a child can feel comfortable and maybe say to me, Dr. Lasky, I don't like what you do, but I know I feel safe with you. That's okay, because at least I know that they know that as when they're an adult and they're in the world, they can hopefully find somebody they feel comfortable with, and will go for their biannual dental cleaning, so they can keep their body as healthy as possible.
This is why we love you.
Oh, thank you.
I hope everybody actually can say they love their dentist, because you're top notch.
If I had had you as or someone like you as my pediatric dentist, I would have not had a gap in my adult life with fearing and then not going to the dentist.
Right. I mean, that's the whole thing. It's like avoiding. I mean, I know there's like some things you put your hand in your sand, it doesn't hurt, so I'm not going to go. But then when it hurts, it's like, I wish I could have seen you, X months ago. It's counterintuitive what we want, because it's like, it's not bothering you, but it's really prevention. Ounce of prevention is worth a pound of cure. And it's true. It's so true with the mouth. It definitely. And that's why that's my biggest thing. If finding, the right dental home for anyone throughout the country, I think is a gift. And you have to find someone who loves what they do. I think it's imperative.
Well, thank you for your time.
Of course. Thank you. Appreciate it.
We don't get this much time to talk normally in the dentist chair.
And you're so informative, and I've always loved how your mind works, and you get the information, but with a great personality with it, and we appreciate it.
Thank you.
Please follow us on Twitter at If We Knew Then Pod, and you can drop us a line on our Facebook page at If We Knew Then Pod, or visit our website, ifweknewthen.com, to send us an email with questions and comments. And you can join our mailing list there and get alerts of future podcast episodes. All these links will be added to this episode's show notes. Thank you again, and we look forward to you joining us on the next episode of If We Knew Then.